My name's Dr. Lucy Side and I'm the lead for the module in medical genetics. This module forms part of the MSc in prenatal genetics and fetal medicine. And I'm going to introduce the module on this video. I run it together with Dr. Maria Histova. She's one of our senior scientists here at the Institute for Women's Health. Maria has a particular interest in neurological conditions and also in perinatal neurology. I'm medically trained and I work as a consultant in clinical genetics at Great Ormond Street Hospital, as well as here at the Institute for Women's Health at UCL as a consultant senior lecturer. In my clinical practice, I see a wide variety of patients with genetic conditions, and I have a particular interest in clinical cancer genetics. I've been working in the field since 1998, and prior to moving to UCL, I worked in Oxford. As well as teaching on this module, I teach clinical medical students here at UCL in medical genetics. But most of my working week is spent counselling and advising families with inherited conditions. Although individually genetic disorders are rare, collectively they're relatively common, and up to 40% of hospitalised children in the UK have an underlying genetic condition or congenital abnormality. The aim on this module is to provide you with knowledge of basic medical genetics and how genetic disorders arise. We hope that you'll gain an understanding of the ethical implications of genetic testing in the clinic. The module covers all aspects of medical genetics, and we use examples of dominant, recessive, X-linked and multifactorial disorders. Our lectures include sections on clinical diagnosis, on treatment, on genetic counselling and screening, the relationship of genotype with phenotype, genetic variants in different populations, and gene function and how this influences potential new treatments and therapies. What we aim to do is to give you a flavour of the different genetic disorders that we see in the clinic and how knowledge of the genetic mechanisms of these underpins the management of families as well as new research into these conditions. At the end of the module, we hope students will be able to demonstrate a working knowledge of the diagnosis and treatment of common genetic disorders and modes of inheritance. They should understand when genetic testing should be carried out for a particular disorder. And they'll have the opportunity to study two genetic conditions in greater depth of their own choosing in the essay that they're asked to submit at the end of the module. As well as lectures, the module involves a number of tutorials, and we use case studies and ask students to use these to describe how they might manage families with particular genetic conditions. These will also illustrate some of the ethical dilemmas that can arise in genetic counselling. Uniquely on our MSc programmes, we have observation days in a number of clinics, including the fetal medicine unit here at UCLH, and this relates particularly to this module as students will have the opportunity to observe prenatal management of genetic conditions and congenital anomalies. And this year we are also introducing a role play session on genetic counselling in the clinic, and this will be run by our genetic counsellors at Great Ormond Street Hospital. As well as teaching, there will be opportunities for our students to pursue laboratory projects relating to medical genetics if they wished, as one of the options for their dissertation at the end of the MSc. Our students go on to various careers, and many of them have gone on to genetic counselling, and there will be more opportunities to find out about this as part of the